Typically, 4 individuals are needed to transfer the anesthetized patient from the OR table to the gurney. The anesthesia provider remains at the patient's head and coordinates the transfer. Additional team members position themselves at the patient's sides and feet. When the anesthesia provider gives the signal, the surgical assistant rolls the patient toward himself using the draw sheet, while the anesthesia provider and the STSR support the patient's head and feet respectively. The circulator places the roller under the patient's torso and takes the end of the draw sheet from the surgical assistant. Be certain that no tension is placed on the IV tubing during the transfer. The circulator and surgical assistant brace their bodies against the OR table and the gurney respectively to prevent slippage. The anesthesia provider will again signal when he is ready to complete the transfer. While the anesthesia provider supports the patient's head and the STSR supports her feet, the circulator lifts the draw sheet slightly and pulls her toward himself, while the surgical assistant slightly lifts the sheet and pushes her toward the circulator. The transfer device is removed. The side rails are raised, the wheel locks released, and the patient is transported to the PACU when the anesthesia provider is ready. Note: additional personnel have been called in to care for the patient in the PACU. In this situation, it is not necessary for the STSR to accompany the patient to the PACU. Once the patient leaves the OR, the STSR begins breakdown of the setup. Remove any sharps from the isolation basin and the Mayo stand and place them on the back table with the other sharps. Remove the instruments from the isolation basin and the Mayo stand, open the ratchets or disassemble each instrument as needed, and place them in the basin of water. The basin containing the soiled instruments is placed on the case cart. The instruments on the back table that were not used for the procedure may be replaced into the instrument tray. The instrument tray is placed on the case cart. The sharps magnet is closed and placed in the puncture-proof biohazardous waste container. All disposable items are placed in the waste receptacle. Suction canisters and tubing must be discarded. The OR furniture is positioned.